I'm guessing that most of you know somebody who's diabetic, and that's because there's 100 million people in the United States that are diabetic or pre-diabetic. That number is increasing every year, and that is costing our country, including your health insurance, including your out-of-pocket costs, including our Medicare, Medicaid population, billions of dollars. The sad thing to me also is that pediatric diabetes is on the rise, and that's due to our kids are more sedentary now. They sit around on electronics a lot, they're overweight, and they're obese. I want to talk to you a little bit about the progression of diabetes. So the first stage of diabetes is called insulin resistance. So what happens in the body, glucose or sugar is our fuel. So it travels around in our blood and it plugs into our cells to provide us fuel. But what happens before that glucose goes anywhere is it has to follow insulin. So insulin comes from our pancreas, and there's always a steady flow of insulin coming out of our pancreas if our pancreas is working well. And then when we eat, there's a bolus of insulin that comes out, help bring that blood sugar that has gone up, help to bring it back into normal limits. So insulin works by traveling around our bloodstream, going into our cells, because wherever insulin goes, the blood sugar will go. So all of our cells, our major organs, have insulin receptors. So think about an electrical plug. So here's your electrical plug, your insulin receptor, and here's your insulin going around looking for places to plug in. In insulin resistance, some of these receptors go away. They're just no longer there. So you have insulin that's going around your blood, trying to plug in. Oh, there's no plug in there. Go another place. Oh, there's no plug in there. So now you have insulin, high insulin levels going around in your blood vessels. And the real problem with that is it causes inflammation. And inflammation, for lots of years, causes things like heart attacks, strokes, and cancers. So that's the very first stage of diabetes. And it can take years before blood sugar actually goes up. So if all you're checking on yourself are fasting blood sugars with your annual labs or whatever you get, you're going to miss the very first stages and the preventable part of diabetes. So at Julian Healthcare, we always check insulin levels on people who I feel are at risk for diabetes. And when those insulin levels are starting to ramp up, we really talk seriously about, hey, you're going to be diabetic within the next decade if you don't change anything. And there's lots of things that you can do to make those insulin receptors to come back alive, and then your blood sugars will not go up. Some of the risk factors for diabetes include family history. If one of your parents or siblings have diabetes, that puts you at bigger risk. If you are overweight, have a sedentary lifestyle, if you eat high sugar processed foods or drinks, and if you have chronic stress. Because chronic stress raises cortisol levels. Cortisol is a steroid, and think about prednisone. Prednisone increases blood sugar just like cortisol does. There are several things that you can do, like I said, and most of those are lifestyle changes. So you can start eating a more plant-based diet, less sugars, less processed food, more whole foods. You can also get better sleep. Believe it or not, people who sleep less than 6 hours are more likely to be overweight. Those people are also likely to eat more sugar because sugar helps to increase serotonin. When we don't sleep, our serotonin falls, and it's a vicious cycle. We want to eat more sugar. Increasing activity, even adding a little bit of exercise. I'm talking 30 minutes a day. Just regular walking can help wake up those insulin receptors again, so your insulin can then plug into them and your blood sugar can go into your cells and get out of your blood vessels. Managing stress, obviously, to help get that cortisol level stable and so that it's not high all the time. And then sometimes when those things don't work to bring down those insulin levels or the blood sugars, then I recommend nutraceuticals. So again, those are supplements that are made out of plants, amino acids, fatty acids that the body may be lacking. I just wonder how I can help you or one of your loved ones decrease your risk for diabetes or even heal your diabetes. I've had many patients been able to get off of their diabetes medicines if they were motivated to make lifestyle changes.